Hello, I'm Jim Davis, President and CEO of Amsterdam Nursing Home. We know this is a difficult time for our families, not being able to visit their loved ones, and we know that transparency is so important. In an effort to communicate with you, we plan to have regular videos of the measures we are taking to protect and care for the residents of Amsterdam Nursing Home, and to let you know of all the things we are doing to provide our residents with the best physical and emotional care possible. We plan to have different department heads speak to you on their specific areas of expertise and explain their important contribution to the care of each resident. But before I introduce our first speaker, let me just say that in my 47 years of being in the field of caring for seniors and the frail elderly, nothing has been more challenging, stressful, and disruptive as COVID-19. It is an unprecedented event for healthcare providers, and every day represents the most daunting challenges we have ever faced. But please be assured that we are taking every precaution possible to ensure the safety and protection of your relatives and friends who are residents at Amsterdam. We are constantly monitoring all of the guidance we receive regarding best practices to care for our residents, including all precautions possible. We have full-time medical staff, registered nurses, infection control practitioners, the best CNAs, and many other frontline workers, all focused and dedicated to making sure we provide the safest environment possible. We have social workers, activity staff, making every effort to keep our residents as socially engaged as possible. We recognize the importance of emotional well-being and are trying very hard to maintain the best quality of life possible for Amsterdam residents. And one last comment before I introduce our first speaker. I have been privileged to be the President and CEO of Amsterdam for almost 32 years. I have always been proud of all the staff at all levels and areas of expertise for the extraordinary work they do each and every day. But the pandemic we now face has made me realize how very, very special every employee is at Amsterdam. Day in and day out, Amsterdam employees come to work, leaving their families to care for yours. They walk into Amsterdam with a smile and with enthusiasm and leave Amsterdam the same exact way. In addition to having to care for the most vulnerable population to COVID-19, they often have long commutes and their own families to care for. But they keep coming back to work, and they keep coming back to work with the same positive attitude every day. I could not be more proud, honored, and humbled to be the CEO of an organization with such committed and compassionate people. I will eternally be grateful for their extraordinary efforts and the sacrifices they are making to ensure the physical and emotional well-being of all the residents of Amsterdam. Please rest assured that we will do everything possible to ensure that your relatives and friends receive the best care and quality of life possible in this extraordinary and unprecedented time. Together, we will all get through this. I now will introduce our first speaker, Mr. Bill Pascacello, our Senior Vice President and Administrator. Please be safe and stay well. Thank you.
Hello, I'm Bill Pascacello, Senior Vice President and Administrator of Amsterdam Nursing Home. Residents and staff safety is our primary focus. In order to safeguard our residents and staff members, we have implemented strict protection protocols in accordance with guidance issued by federal, state, and local regulatory agencies. We continue to monitor regulatory guidance daily and review our protocols accordingly. Early on, we implemented an extensive emergency preparedness plan and activated our emergency management team, led by our Vice President of Nursing, who you will hear from shortly. Myself, and joined by our Medical Director, who you will also hear from shortly, and other clinicians. Our team is in constant communication, working to minimize the risk of our residents and staff to being exposed to contracting COVID-19. We have undertaken additional precautions, including restrictions of visitors, including volunteers and non-essential vendors, and nightly disinfecting by a specialized cleaning company, in addition to daily cleaning by our internal housekeeping staff on high-touch surfaces and high-traffic public areas using hospital-grade disinfectant. We recognize the hardship of separation on residents and families and have dedicated staff arranging for video conferencing and other communications. You can schedule a FaceTime session or phone call with your loved one between the hours of 9:30 a.m. and 12:30 p.m. and 1:45 p.m. to 4 p.m. 7 days per week by contacting your social worker assigned to your family member. Thank you for your support and understanding, and stay safe.
Hello, I'm Dr. Jeff Gold, the Medical Director at Amsterdam Nursing Home. I welcome the opportunity to inform you regarding the medical status at Amsterdam regarding COVID-19. We continue to monitor all residents for signs and symptoms of infection. And similarly, we are monitoring every staff member every time they enter the building. If a staff member exhibits a fever or other symptoms suggestive of infection, they are not allowed to come to work, and we instruct them to go see their medical provider. And similarly, if a staff member becomes ill while at work, we escort them from the building promptly and instruct them again to see their medical provider. Now, it's interesting, the symptoms that are associated with COVID-19 have been highly variable. I think most of you are familiar with fever and cough. And while many residents have had those symptoms, there have been numerous residents who are COVID positive who have had a wide variety of symptoms, different types. The more that we learn about this virus, the better we will be able to identify those residents and staff who are at risk. When we have a suspicion of COVID-19 infection, we initiate strict Department of Health recommended infection control precautions. These are known as droplet precautions. They are intended to prevent the spread of respiratory droplets that are carrying COVID-19 virus to others and preventing exposure on hard surfaces. In these cases, the staff wear what's known as PPE, personal protective equipment, which includes gowns, masks, eye protection, and gloves. As you may know, if you've been following the news, there have been intermittent nationwide shortages of PPE. But rest assured that Amsterdam has worked all of its sources to gather as much supply as possible. In order to protect our residents and our staff, since the very beginning of the pandemic, we have been focused on providing the necessary PPE, along with education, to provide care while minimizing the risk of infection. There's also been a lot in the news about testing. So I'd like to update you regarding the status of testing here at Amsterdam. We have again followed New York State Department of Health guidelines regarding testing procedures. At present, testing is limited to serological testing. That's testing that identifies those with an active infection. This is done, as you may know, through nasal or oral swabs. As availability of testing has become more available, we have begun testing of residents. We have started testing with those with a high suspicion of having coronavirus. And our plan is, once completed, we will explore opportunities to then test asymptomatic residents. As per our policy at Amsterdam, all family and designated representatives will be informed if their loved one is diagnosed with COVID-19. Again, this type of testing tells us who has or who does not have COVID-19 infection at present. Now, it is also our hope that there will also be antibody testing available in the near future. This testing should tell us who has recovered from infection, who has developed immunity and presumably is no longer able to transmit COVID-19 infection or to get reinfected with COVID-19. This antibody testing will be extremely important for our staff, allowing us to determine who can safely resume providing care here at Amsterdam. As with many long-term care facilities in the New York metro area, we currently have COVID-19 positive residents at our facility. Some of these residents were long-term residents residing here at Amsterdam. Others are newly admitted residents transferred from our acute care partner hospitals when they are medically stable. Many families have asked, when do we remove a COVID positive patient from the isolation precautions, those droplet precautions that I described earlier? Well, again, we follow Department of Health guidance on what are called recovery criteria. These mean when we can feel confident that the acute infection has passed and the risk of transmitting infection is no longer present. You may also be aware that there are several experimental treatments for COVID-19 that are available on a limited basis. Our medical staff is making individualized determinations to decide whether investigational therapy is appropriate for a resident. This is a rapidly evolving situation, and as new data becomes available, we hope to better be able to tailor medical regimens accordingly. I'd like to say that we understand how difficult this time has been for you, for the residents, and for our staff. Everyone here at Amsterdam is striving to provide the best care possible. Our staff has been working very hard under very difficult circumstances. Thank you for your patience in this difficult period.
Hello, I'm Gertrudis de Guzman, VP of Nursing here at Amsterdam Nursing Home. I hope this message finds you well. While it is mentally and emotionally difficult for you not to see your loved ones during this unprecedented time of coronavirus pandemic, be assured that we are doing everything in our power to protect the health and well-being of our residents. I am proud to say that Amsterdam Nursing Home is blessed to have dedicated staff comprised of nursing administration, RNs and LPNs, certified nursing assistants, and other clinical and administrative support teams who continue to report to work despite the risks that they have to take to ensure that the needs of our residents are taken care of on a daily basis. I have never been more proud to witness our employees' acts of courage and dedication as they continue to serve our most vulnerable population, that is your loved ones, with love, kindness, compassion, and respect for their dignity. So if you would like to send a note of appreciation and encouragement to our brave and devoted clinical team who would love to hear from you, please do so at the address on the screen below. Thank you, and just like you, we also hope that this crisis will be over soon.